Well, good afternoon and welcome to the Doctor's Inn. And today we're going to talk about health insurance because it's that time of year when the health exchange opens up. And the good news is there's people here to help you. Doctor's Inn is brought to you by Bay Area Medical Center, and we have with us today Jenny Reisner, who serves as BAMC's Patient Access Registrations Manager. She's been with Bay Area Medical Center for 18 years in the revenue cycle. And Amy Bunting is one of BAMC's 3 financial counselors and has been a certified application specialist for 2 years. Welcome to the show.
Thank you. Thank you.
All right. Open enrollment coming up. What are the dates?
It'll be a 6-week time frame again, and we start this Thursday, so November 1st, and it runs through December 15th.
All right. And so what does open enrollment mean?
So open enrollment is the one time per year that individuals can enroll, switch plans, and qualify for subsidies or cost assistance on their health plans. If you don't enroll during the open enrollment period, which is typically at the end of each year, then you would have limited options to qualify for health insurance through the marketplace for the remainder of that year. You would have to have some sort of qualifying event outside of this open enrollment period.
All right, let's talk about what some of those qualifying events would be.
So that would be something like you had a child, you got married, something of that sort.
Lost your employment maybe. There's different factors, and not every life-changing event qualifies you as well.
Correct.
All right, and so if you don't have one of those life-changing events, you basically have to wait till this open enrollment period to get into the health exchange.
Exactly.
All right, who qualifies for open enrollment and the health exchange?
So we would be looking at trying to help people who are uninsured. People who are offered health insurance through work sometimes can get a marketplace plan as well. The only difference is that if it's deemed affordable by their standards, you may not be eligible for the tax credit or subsidies that are offered.
Want to give a little explanation of what affordable means?
Well, the marketplace says 9.56% of your gross annual income. So we're able to help you figure that out as well.
All right, so it depends upon what your income is as to whether your work plan is affordable or
Correct.
not.
Yep.
No matter what you may think.
Exactly.
The government has a definition.
They sure do.
Okay. So if people are already enrolled in the marketplace for 2018, then what happens if you want to continue?
So some of the plans will automatically enroll you in a plan for the 2019 year, but we suggest that you still come in and meet with us so that way we can update your application just to make sure that your income is on track with where it needs to be. If something was different this year, we want to make sure that that's accurate so you're not responsible for paying any tax credits back or anything like that.
Because depending upon your income level, you may get a tax credit, but if you made more money than what you told them you were going to make, you may end up paying back at the end of tax time.
Correct. You may be penalized for that.
All right. So if you have a 2018 plan, you say it may automatically renew?
Some of them do. Yep, you would get a notice in the mail letting you know that you could be expecting that, and then they let you know to take action if you're looking to try to change plans.
Okay. So what are the health plan options we have in this area?
Well, we're a border community, so we help with both the Menominee County and the Marinette County residents. Michigan's a little bit more limited. We see, last year we saw Blue Cross and Blue Care, and that was Menominee County, where Marinette County was Common Ground. We think that Molina may be coming back.
Sounds like Molina will be available for residents of Brown County only. Marinette and Oconto counties, from what I heard on a recent call, will have Common Ground available to them, and that will be their only option, unfortunately.
So having just one option isn't necessarily a good thing, but it's all you have here in Marinette and Oconto.
You will see multiple plan options, though.
Okay, so there's different plans under that
Correct.
company. So.
Correct.
All right. So as we all know, insurance can be expensive. So what are the options that you have with those different plans?
Premium prices generate for patients based off of their income. So we would be calculating figures that way to see what kind of numbers would come up for them.
So the one thing that's important for people to remember when they're looking at those different plans is not necessarily just the cost of the premium. They'll want to look at what their cost for the total healthcare expenses that they think they're going to have for that coming year when picking their plan. So not only the premium plays a factor, but if they're going to have high utilization, they might want to look at what their other out-of-pocket expenses would be, such as their co-pays, their co-insurance, things like that can also factor into which plan might be best for you.
So it's not necessarily just the premium cost.
Right, and that's what people will want to remember. Yeah, they'll want to make sure that when they're picking their plan, they're basing their total cost of care. The plans, usually the marketplace has 5 different plans: bronze, silver, gold, platinum, and catastrophic. The catastrophic is only available to those that are 30 years or old or younger, or people who are facing a hardship exception. Generally, the gold and the platinum plans cost a little bit more, but your total out-of-pocket costs are less because they pay more for your services, where the bronze and the silver might cost you a little bit less for a premium, but it doesn't cover as much with your healthcare expenses.
So that's why kind of, if you think you're going to be using it a lot, it might be better to buy one of the more expensive plans, more expensive premium.
Correct. Mm-hmm.
So, all right, so there's the 5 categories, and the bronze is the cheapest, the platinum is the most expensive premium-wise.
Correct.
Anyway, and how do you, what are some of the factors? Obviously utilization. What are some other things you look at when going over the options with a person?
I would always ask them how much they intend to use their health insurance first, and if they're relatively healthy, what providers in the area are you using, so that way we know whether or not they were in network, what kind of prescriptions are you taking. You know, that way we can kind of figure out, okay, should we go with the higher premium or the lower premium plan.
And just because Common Ground is the only insurance that's available for Marinette and Oconto County, people need to understand that we can only make recommendations. We can't tell them which plan to sign up for, so it's really important that they're also looking at that so that they don't accidentally pick a plan that doesn't have coverage in the service area where they would be receiving their medical services.
As far as the providers being included?
Right, so like if for example they decided they wanted to purchase Molina insurance because of the premium cost, but then they wanted to utilize services here in the Marinette County area, that their services would not be covered by Molina. So they want to make sure that whatever insurance plan they're picking is going to cover whoever their physician is that they see, as well as wherever they receive the services for their health care.
So how long does it take to figure all this out with a person typically?
Well, it depends. Sometimes people have more questions, so I would say anywhere from about an hour to an hour and a half.
Okay, and when we need to have this done by when?
By December 15th, that would be the last day of open enrollment.
All right, so if somebody wants your assistance, or I guess first of all, if they want to get into the marketplace, how do they do that?
Well, they can always call the call center. The number for that is 1-800-318-2596, or locally they can schedule an appointment with us here at the hospital. There's myself and 2 other application counselors there to help, and we will meet with them and go over any questions that they may have.
Okay, so just set up an appointment?
Absolutely,
time
yep.
Convenient? And
Sure.
How do they get a hold of you?
They can call our scheduling department, and that number is 715-735-4202.
All right. Are things getting better or worse on the exchange over the years? Who's been working on it? Is it getting more complicated to figure this out, or is it getting easier?
I don't believe so. I don't think it's getting complicated. People are getting more used to it, and the application process really isn't that difficult at all.
I know the first year it was people who were getting into it had a lot of questions,
Oh,
and
sure.
it was very confusing, I being one of them.
Anytime anything's new like that, though, you know, so.
Okay, so once again, let's talk about the people who are eligible to use the health exchange.
So anybody that is uninsured, not offered insurance through their work, people that are employed and offered work insurance, you may still be eligible for a marketplace plan, but probably not eligible for the tax credit or subsidies.
Okay.
Basically, anyone who doesn't have Medicare. If you have Medicare, you're not eligible for the insurance, but anyone else could purchase, just may not get the subsidies.
All right. Well, it makes me feel good to know that there's somebody locally here who has the knowledge, and you work with this all the time, and know what questions to ask.
Sure, and we're happy to help.
So once again, how do they find you?
Come right to the hospital. We're located at 3003 University Drive, or call the scheduling department, 715-735-4202.
All right. And again, December 15th is the magic day. You got to get it done by that. All right. So thank you for being with us and telling us that, yes, there's help out there.
Absolutely, thank you.
Thank you.
Okay, our guests today have been Jenny Reisner, the Patient Access Registration Manager, as well as Amy Bunting, who's one of the financial counselors at Bay Area Medical Center, as they help guide us through the health exchange and the open enrollment period. Thanks for being with us.
Thank you.